Hello, Dr. Goodwin. Nice to meet you.
Yes, it's good talking to you as well about such an important subject as cardiovascular disease and type 2 diabetes.
I agree. This is an important topic, a very high-risk group of patients, and one to have new treatments for is really exciting new development.
Right. Now, it's called a breaking news development. What would you say is the bottom line of the breaking news?
Well, the news is that the FDA has approved for the first time a diabetes treatment for the indication of reducing the risk of cardiovascular death. All the other diabetes treatments are approved for use to lower glucose, but now for the first time we have something that's been shown to and now FDA approved to reduce the risk of dying from cardiovascular disease.
And is it on the market yet?
Yes, this agent, empagliflozin, or known as Jardiance, has been approved for lowering glucose several years ago, and this is a new indication for use that the FDA has granted for empagliflozin to reduce the risk of cardiovascular death. And it pertains to people with type 2 diabetes and known cardiovascular disease.
And so it's the combination. Is it the combination of diabetes and cardiovascular disease, or cardiovascular disease and diabetes? What is the trigger?
Well, amongst all the people with diabetes, those who already have signs of cardiovascular disease are those at highest risk of dying or developing a second heart attack or stroke. And so it's in that segment of the population in diabetes that this would apply to. As you asked the question, many times as cardiologists, we have a patient come in with a heart attack and we'll first discover for the first time that they actually have diabetes. And so it's a patient who has both where this new approval would apply.
I see. And the increased risk of death occurs in those persons who have diabetes and cardiovascular disease?
Yes, from each direction, I suppose. In people with diabetes, those who have had signs of cardiovascular disease are at much higher risk of developing a recurrent event or dying. And conversely, amongst people who have heart disease and cardiovascular disease, those with diabetes are at much higher risk relative to patients without diabetes. And so this is a very high-risk group of patients where having a new treatment that has FDA approval to reduce the risk of cardiovascular death is so exciting.
Yes, that is in fact exciting. Now, what is Jardiance? Jardiance is the actual brand name?
Yes, that's the brand name for the drug empagliflozin, is its generic name. And this is a drug in the class of SGLT2 inhibitors. And they block reuptake of glucose in the urine, and so you end up excreting glucose and fluid in the urine, and so that can lower not only glucose levels in the blood, but also blood pressure, and as such be beneficial. And then the study that was done that led to the approval looked at the risk of cardiovascular death and found a 38% reduction when using empagliflozin on top of the standard therapies versus just the standard therapy. And so a really dramatic improvement in outcome that was seen in a study of over 7,000 patients.
I see. And is it being used globally or mostly in the U.S.?
This is an agent that is available globally, and so this would apply to patients around the world.
I see. Okay. That's very, very interesting. And what would be the major risk factors for using Jardiance?
Well, this agent, the way it works with more diuresis or fluid out is that it can cause dehydration and low blood pressure. And so those are things that one would look out for. Other small side effects can be genital infections, and a few percent of people is something that differs from other classes of drugs. But fortunately, a known safety profile amongst the different diabetes drugs. And then conversely, that's balanced by a reduction in cardiovascular death, and so a wonderful benefit that is seen that FDA called their attention to with this new indication.
I see. Okay. Is there what is the best source for people to get more information about Jardiance and its use?
Well, there are information if you Google on the web, but I think the best place is to really talk to your doctor, be it the primary care physician or cardiologist, to see amongst all the therapies that a given patient is receiving, would this fit in and be a good addition to their treatment?
I see. Okay. And is there a web address that we should give to people who are interested?
Well, there is Jardiance, is often the case. Jardiance.com will have information that led to the approval. The New England Journal of Medicine website has the study EMPA-REG that led to this approval, and so those are some places. But I think making sure to talk through with your doctor in the context of other treatments would be the advice I would give to my patients in any case.
Okay. Okay, one last thing. You mentioned of course, primary care physician and the cardiologist. And Jardiance.com, where do you get that? Is that Google?
Well, that is available on the web. That is the web address, or Dr. Google, as I often refer to, is a good source of information. But the point you made about the primary care physician and cardiologist is one where we will have increasing dialogue between us to try and co-manage these patients more closely with regard to their diabetes treatments. And so it will be a nice era of cooperation with the patient, primary care doctor and cardiologist, and endocrinologist if they have one, to try and get the best treatments for our patients.
And I see you're essentially based at Harvard Medical School?
Yes, up in Boston at Brigham and Women's Hospital and part of Harvard Medical School.
Okay. So that would be another way that PCPs, primary care physicians, could get in touch with you.
Yes, we'd be happy to talk with folks. It's an exciting new time and one where dialogue and sharing of information as we enter this new era of diabetes management for these cardiovascular patients.
And would you we call this breaking news? Would you want to categorize it as high? Let me see. What do I want to call it? High level breaking news? Is it something very new or something that's new?
This is very new because it's the first time in several decades that a treatment for diabetes has been shown to improve outcomes. And so it's a whole new era that we simply have not seen in the past. And that's why I think we as cardiologists and all healthcare professionals really have taken notice of this as a new era in the management of diabetes and cardiovascular disease. So a really wonderful new development.
Well, I certainly appreciate having had the chance to discuss this and to share this information with my... and by the way, Health Power focuses significantly on minority populations, African American and diabetes and so forth. Is there any particular correlation related to minorities that we should take note of?
Well, there is a higher rate of developing diabetes, I believe, amongst African Americans, and so this is relevant to many. Fortunately, the benefits that were seen in the study had equal benefits across all of the different patient groups and races. So. It's really good news on that score that for the many minorities who this could affect, this is a very relevant new treatment.
Right. Well, I certainly enjoyed talking with you and sharing this information with Health Power's audience, and we will certainly look forward to hearing more about it.
Terrific. Well, thank you very much for having me.